Good evening, everyone.
Good evening.
Good evening. Good evening. Thank you for coming. So welcome to the Cooley Dickinson Hospital, Massachusetts General Hospital lecture series. I'm Dr. Lindsay Rockwell. I'm a hematologist and oncologist here at Cooley Dickinson. And we are here for a much anticipated lecture presentation from Dr. Anne Catherine Goodman on the role of acupuncture in cancer care. Dr. Goodman is a gynecologic oncologist and the director of the Gynecologic Oncology Fellowship Program at MGH. I'm just going to say MGH for sake of shortness. She is also an associate professor of obstetrics, gynecology, and reproductive biology at Harvard Medical School and a fellow of the American College of Surgeons. In addition to board certification in gynecologic oncology, she is also certified in acupuncture and has completed training in both pastoral and palliative care. She is the past president of the Obstetrical Society of Boston and of the New England Society of Gynecologic Oncologists. How many syllables would you say are in each of these sentences? A lot. Dr. Goodman is a member of the International Medical Surgical Response Team, a branch of the U.S. Department of Health and Human Services, and has deployed to various international disasters, including BAM, Iran, 2004, Banda Aceh, 2005, Haiti, 2010, and the Philippines in 2014. She received the 2012 ACOG International Service Award for service to pregnant women after the Haiti earthquake. Since 2008, Dr. Goodman has been consulting in Bangladesh on cervical cancer prevention and the development of medical infrastructure to care for women with gynecologic cancers. I would like to welcome yet another force of nature, Dr. Anne Catherine Goodman.
Thank you so much for coming. It's very moving to see you all here, and I hope this lecture is okay. I'm a little spacey. I did it on the plane coming back from Qatar, and I had a really sick seatmate, and so I was a little distracted, and there were kids running, and it was very interesting. The whole thing was fun, but you guys will sort of help me through it. And what I wanted to do, let's see if this works. Yeah, what I wanted to do was maybe just take a step back and selfishly, I sort of do this for myself. Hopefully it'll be useful. Just think about a little bit about the concepts. So what I wanted to do was to give you some background and think about the way illness is conceived in the non-Western, what we call allopathic, kind of what we went to medical school for way. And then talk about the various modalities. The main one that I really know about is acupuncture, but there's other ones just to kind of round it out, because for people who do have an interest in either participating in a non-allopathic medicine as part of their care, they won't necessarily always do acupuncture. So just sort of put that in perspective. And that's sort of what I wanted to start. And I wanted to start with maybe a few personal experiences. I've done acupuncture for about 10 years now. I do not consider myself an expert, I really don't. I consider myself a student and a learner. But like I said, my disclosure is I'm a learner. I do some acupuncture. My day job is really as a gynecologic oncologist, but I see these other modalities, I'll try and yell, these other modalities as being useful. And there is some actual research to support them. So my first patient, just to let you know, but someone I took care of for many years, she had cervical cancer, and then terribly she got melanoma, which metastasized to her brain and developed this intractable nausea. It was on radiation and chemo, and came to see me for some acupuncture. And I did the standard, which I will talk about, the standard points. And I also added something, these called magnets, these little guys here, which are these little teeny magnets that you can put over the points, and then you can just zap them for however long those magnets stay on afterwards. and it totally fixed her. I was like, whoa, that is so cool. I have no idea, but anyway, this is my success story.
One more time.
Okay.
Sword.
And then just as another example of someone I took care of, a woman who developed advanced metastatic gastric cancer and had a lot of quality of life issues, had very tough chemo that she was on, multi-drug chemo that unfortunately, ultimately, she didn't survive. And I took care of her for about a year and a half, and she came and saw me a lot, every few weeks. And I just sort of wrote down, and this is the only time I'm going to go through this in some detail, what we did was we do about an hour session. I'd put in the needles, and then we'd warm them up with a little bit of an infrared light. And I sort of put in a few points that I'm going to tell you more about, stomach 36 and liver 4, lung 5. I'll explain those a little bit more to you. Shenmen, I'll tell you what that is in a bit. And then take them out and then try a few other points and see how she's doing, and then give her some magnets. And she found that tremendously helpful. It was very comforting. She came back a lot to see me for the time that I knew her. And then, of course, there's also people that you don't help. And I'm always very intimidated by that. This particular young gentleman, the acupuncture practice is the only place I take care of men. It's very interesting. They have very different skin than women. It's very interesting. It just feels different. They're thicker. But this poor gentleman had a brain tumor that led him to have intractable hiccups. And I just couldn't figure out what to do. Now he, of course, being through every other medical therapy that hadn't helped him, he was over at Spalding, and he just hiccuped all the time. I mean, the suffering this gentleman had was tremendous, and I was so intimidated by his suffering, which brings up some interesting self-reflection about if you're sort of intimidated and in awe of the disease, sometimes it's a challenge to sort of handle it. But anyway, I did not succeed in him. So acupuncture doesn't always work. I didn't have the skill to help him. It's interesting, there's been many surveys at this point asking people, and say people who are survivors of cancer, for instance, do they do what we call complementary and alternative medicine? So this is one survey, a 6-month period of time. This pharmacologist actually surveyed people who were coming in through the cancer center, and he did a questionnaire with them and a brief interview, and discovered that 85% of people used some form of stuff that they didn't tell their doctors about.
What is CAM?
Yes, complementary and alternative medicine. Thank you, thank you. So that's sort of one of the many terms that are used as an abbreviation that just sort of means all sorts of things that perhaps you've heard are good, megavitamins or herbs or acupuncture or massage or Reiki, or it's just a ton of different sort of things, and it all goes under that. And drilling down, the majority of people did megavitamins and minerals, and a lot of them did more than one thing in addition to what they were doing for their cancer. About half of them only did the megavitamins and the minerals. About a third of them did some herbal preparations, okay? And some other group, some other small fraction did food supplements, and then sort of about 10% did acupuncture and other various things. So it's just sort of interesting to know that people who have illness that they're doing a lot of work with around, especially with cancer, a lot of times are doing other things, point being we need to ask about it. So just to talk about, we'll call traditional Oriental medicine. We always think of it as traditional Chinese medicine, TCM, but it's broader than that. It's not just China, it's a lot of these areas that have influenced philosophically practitioners in the United States who do acupuncture and other CAM therapies and so forth. So traditional and basic principles, I'm going to go through a little bit. There's something called 5-element theory, which I'll talk about some more. The way, the significance of your sort of how your life is in order, sort of very meditative, philosophical stuff. The whole yin and yang concept, okay, it's important. the whole issue of something called qi, which I'll talk about too. So these are all, various components that are things you don't learn in medical school, right? I mean, we don't learn in our allopathic courses. One of the issues with this whole, what we call traditional Oriental medicine, is it's very holistic, and it involves not just one directed therapeutic intervention. It's usually diet and lifestyle and exercise and mental stuff and then whatever else it is. So there's a lot of stuff that is part of what's considered important for healing. Okay, so if we think about the origin, let's talk about Chinese medicine, where the history of that has been looked at and studied. It's a very interesting history. It derives from a very, very long time ago. And I will just say parenthetically that because of its history, when you talk to someone who's a TCM practitioner, traditional Chinese medicine practitioner, an acupuncturist, for instance, sometimes the way illness is explained sounds sort of cute. It's a little quaint. It's sort of, stagnation and dampness and heat and, emptiness. And there's these terms that probably in Chinese sound a little less kind of funny, but, compared to, well, that person has neutropenia and, it has a funny sort of quaintness to it that you have to sort of accept. It's basically a language that has been developed that conceptualizes illness in a very different way than we think about it in allopathic medicine. So a long time ago, 5,000 years, the Yellow Emperor is very famous. There's a big book by him. There's also lots of folklore, lots of spirit stuff. So it's all kind of fun, I think. There were sort of traditionally, historically, in China, two types of practitioners. And this is very interesting to me because a lot of acupuncture in Chinese medicine is part of the diagnosis is by pulse, part of it is by looking at your face, looking at your urine, looking at your tongue. Very, very different than the kind of exams that a Western allopathic doctor does, pelvic exam, think about it, pap smears, all that kind of rectal exams. I mean, you just don't do that, okay? And that comes from a class of practitioners that took care of the gentry. There's a lot of modesty in that culture. You don't undress, so it's very interesting that sort of that the ability to try and understand and assess came out of a cultural barrier to seeing someone naked in that culture. And still, sort of Chinese culture is very modest, in terms of different than us, perhaps. And then at the same time, there's also a lot of folklore and practitioners who treat the common people. All that stuff is the background to this, okay? In terms of acupuncture, with that as background, there really was a very interesting book called the Yellow Emperor's Classic of Internal Medicine from 200 before the Common Era that really wrote down the sort of highly empiric analysis of points and pulses and things that made a difference, that made someone better, okay? What was really interesting is that when the colonization, sort of the way the world happened in our history, and the Portuguese came with missionaries to convert everybody, they learned about acupuncture and they brought it back to Europe. And there's actually an old European text on acupuncture from the 1600s out of Holland, and so there was this interesting fertilization that happened around that time. What was really interesting is as the colonization increased and as medicine in Europe sort of took on a much more formal didactic form, and that was brought to China, acupuncture became illegal. So in the 1800s, it was actually banned as something that was an illiterate superstition compared to Western medicine. So very interesting, it was banned. And it really wasn't really rediscovered until after the Chinese Revolution, when the whole barefoot doctor movement happened in China to serve people everywhere. People were trained in what they called TCM. And actually the term TCM ironically, is a new term. It's a term from the Chinese Revolution. It didn't exist prior to that, what they called traditional Chinese medicine, and it was sort of a re-exploration of it. And now in China, there's actually two different schools of training. There's TCM training, where you learn herbology and you learn acupuncture, or there is Western allopathic training. You can choose, as a medical student, which track you want to go on, and that's the one you become an expert in. It's very interesting. And then, of course, in the 1970s, when Nixon visited, this was reintroduced to the West. So I find this whole history sort of very yin and yang. I mean, there's a certain circular resurgence of teaching each other about this sort of stuff. Anyway, so like I said, it's folk medicine side by side with a lot of empiricism, okay, and a lot of trial by error, and a lot of word by mouth. And what's interesting about this is a history to it, as opposed to Western medicine, is that it doesn't come from a place of science. It comes from a place of empiricism. It comes from a place of this works, this is associated and related to this, and then an explanation has been formed around how that happened. It makes it challenging to study acupuncture and other forms of traditional Oriental medicine using a Western approach, because it's a very individualized to each person. And I'll explain that a little bit more. So the next section I'm going to talk about is a little bit of the theory, just so you're familiar with the terminology. Like I say, it's going to sound weird if you haven't been exposed to this. It's funny language, it's funny concepts, and then talk a bit about how diagnoses are made, and then we'll get back to, we'll sort of finish up with talking about how do we use it, what are the points, what's the data that we have, and that's how we'll sort of put this all together. So the 5-element theory, okay, is this idea that the cosmic universe of 5 elements, each represents both something that's important in nature, how you explain nature, storms, the universe, and how you explain the individual body. That's the best I can understand it from my reading. So it's just holistic. It has to do with looking at the emotional, physical, physiologic. Again, that's a very, very, very important concept. So the 5 elements have been studied. There's big books on it. Very, very strange to us, you know, where for each element, wood, fire, earth, metal, and water, they have a direction, as I've written down here. There's a color, there's a taste, there's a climate, wind, heat, damp, dryness, cold. And these terms are actually used to explain by a practitioner what they see as part of the illness in the person. They use this terminology. In addition, using the 5-element theory, they basically divide the organs. Okay, now these are traditional Chinese medicine organs. They don't always completely represent our organs, okay, but they have to do with meridians, which we'll talk about in a few minutes. And the Zhang organs and the Fu organs, the Zhang are the yin, which is the female qualities, and the Fu are the yang organs. And I've listed them here: liver, heart, spleen, lung, and kidney versus gallbladder, small intestine, stomach, large intestine, bladder. And these are all the meridians in the body that are connected on the surface to the deep organs, and they have important roles in illness. Anyway, that's just strange, but that's how it's explained. Here's the modalities. I've sort of listed, again, I've said this a few times: acupuncture, acupressure, we'll talk about Roxy. This is cupping, massage, herbology. Okay, so we'll go through these things. What am I going to go through now? Okay, oh yeah, manual healing, massage, a lot of stuff that has to do with touch and laying on of hands is not really only from traditional Oriental medicine, right? I mean, that's a very big thing around the world in all traditional healing cultures. And we do massage, there's laying on of hands that can be a religious healing. I mean, there's just the gamut around the world, okay? But basically, body work, chiropractic, okay? Again, so lots of different things. Now I'm just going to spend some time talking about diagnosis. of course, to decide what points you're going to use, you need to understand what the illness is of the patient. And this is a very important part of being a traditional practitioner, a TCM practitioner, is the diagnosis, because that is going to inform you of how you take care of that patient. So it's very, very different. This is the important difference with Western medicine, is if someone has ovarian cancer, we're like, okay, surgery, here's our standard chemotherapies, that's what we're going to do. We might modify it because of the stage of the cancer, or this and that, or if you're going to do chemo first or surgery afterwards. But that's about the extent of it. It's very, very different here. Here, your diagnosis may completely change the points that you use, because even though someone comes in and says, I have a headache or I'm nauseated, the reason, the holistic reason for it may be 100 different things. And so how you approach it and treat it may be very different. Okay? And that also is very important in terms of how do you study what's effective, because that's so very personal to the exam and the diagnosis of the practitioner. So it's just very different than the way we normally think about it. So basically, it's about examination. I have to say, just parenthetically, I got into this actually sort of randomly, as everything happens to me, which was I got this flyer back in year 2000 or so that said acupuncture for physicians, Thursday nights, one Saturday a month. And I thought, I can do that. That won't interfere with my day job. And I hear about this acupuncture stuff, and so I decided to enroll in this course, which was a 300-hour course, which is what it takes to be licensed in acupuncture in Massachusetts as an MD, a different criterion for non-MD acupuncturists. And started it just with interest because I was going to be able to talk to my patients who did it better, and was immediately smitten by how amazing what I was learning was. But the most amazing part was the physical exam. The actual touching of people and really using your skills to make diagnoses was amazing. I thought, gosh, they should bring this to physical diagnosis in medical school. This is like so very thorough how that went. So looking at the patient, examining. Now the tasting thing didn't do that. That's the urine. Got to have limits. I am ultimately a Western girl. Don't taste urine. But traditionally they do. Okay? They're looking for probably diabetes, right? The sweet, can't go there. Okay? Interrogation and touching. So all these very, very important parts. And so looking also at the body. And the other part that's categorized is body shape, thin, overweight, stooped, upright. Also emotional aspects. Is the person coming in really angry? Are they red in the face? Are they calm? Are they withdrawn? And that is also a huge part of your diagnosis. It's getting back to the 4 elements. You sort of have a sense of where do they fit? Do they have wind? Do they have, heat? And these are all the sort of terminologies that are used that together kind of put it all together. So here we go. The factors that guide the practitioner, the basic elements of change, yin and yang, the sort of complementary aspects, the 2 sides of every element. And then these other things I've written down here that superficial problem, is it a deep core problem, hot, cold, and so forth. So just there's a lot of this sort of descriptive stuff that's kind of fun and fascinating. In terms of the techniques, it's all about the therapy is to prevent disease. And this is also a very ancient concept. The legend goes something like this, that the court practitioners would not survive if someone they took care of died or became ill, is that they failed in their job to prevent illness. It was the prevention of illness that was the ultimate as a practitioner, okay? Someone actually was already ill, you did what you could, but your job was actually to prevent it. So it's a very, very different concept. Again, we're kind of getting there in allopathic medicine nowadays, healthy heart diet, Mediterranean diet, etc. But this is a very ancient concept from them, preventing disease. So in terms of what does it take, there's also these various things that you can do. You can make your patients sweat, you can make them vomit to purge them. harmonized stuff. And these are just all concepts that when you get to whatever it is your modality is, in my case acupuncture, that's what you're aiming for to overcome whatever it is that's making the illness happen. Okay, and here's some more. Warming, sorry, typo, purifying. By the way, how am I doing? I'm scratching? Or good? Okay, great. Okay, supplying, okay. So these are all the sort of things. Okay, so now we get to acupuncture. All right, so needles, okay, is the tool that you're using once you've made your diagnosis and you know where you're going to go in terms of these meridians to alleviate the illness, to work on alleviating it, okay? You have to be, the Zue is the sort of the pathway, the current in the body, or how do you pronounce that? So I've mentioned this a few times. There's these meridians on the body. There's the ones in the upper body and the ones on the lower body, and it's symmetric, so you have the same ones on each side, left and right, although you may choose to use the left side and the right side differently, again, depending on your thoughts about what your thing you're experiencing and your diagnosis is. The thought is these meridians are channels, each of them associated with the particular organ, that the chi, which is the life force, flows through and keeps you well. And that when there's illness, there's something wrong with that flow, okay? So health is determined by this balance of yin and yang. And basically, when there isn't a balance, there's things called blockages in the flow. And the word stagnation is a real big word. Stagnation is like that's like, saying someone has cancer. You have stagnation, ooh, it's bad, you're sick, that kind of thing. Stagnation causes tumors, all this sort of stuff. Okay, so you have to unstagnate them. You have to unblock whatever the blockage is. So this chi force, which is this mysterious life force, and I think people like me and the books I've read from Western acupuncturists, I always try to figure out, well, what does that mean to us? Is it the bloodstream? Is it the lymphatics? Is it the heart beating? Maybe. I think the concept is bigger than that. It's very kind of almost metaphysical. It's really what's the difference between being alive and being dead. Things that are alive have chi in them. When that life is removed from that being, the chi is gone. Whatever that is. And for all of us who have helped someone pass from being alive to passing, you see that change. I don't know if you've experienced that. It's a profound thing to watch that life go out of somebody. That's what chi is. Very intense. So that's what it is. And basically it's this, oh here, I did this too, I stole this one too. Anyway, okay, so what makes you have a problem with your chi force? Stress, trauma, some kind of diet, lifestyle changes, all these sorts of things. Surgery, thought that was interesting. And it does bring up for me a as yet unanswered question. I've asked, my acupuncture teachers and this kind of stuff. So, I'm a surgeon. I make these like big incisions in people. I'm like going through acupuncture meridians. What does that do? Is that important? Does it change where you treat them? Unanswered. I guess I should study it, but it's sort of an interesting point. Okay, so there's many charts, and these probably may look familiar to y'all, of the body, all the different points. There's also ear points, and there's some acupuncturists who are just specialized in auricular acupuncture. It's very interesting. I find it extremely challenging. Some people are very, very good at it. It's actually a very good technique for on-the-go acupuncture. Actually, tomorrow I'm going to talk about that a little bit more. I talk about acupuncture first aid, and there's something called battlefield acupuncture, which is done actually in the armed forces, where you can put some needles to sedate people and kind of deal with some pain issues, and load them on the helicopter, etc. So there's battlefield acupuncture. It's very interesting. There's a lot of points. You don't use them all. In general, an acupuncturist may use, I don't know, up to 20 points, something like that. There's some acupuncturists brag about knowing just that one needle that's going to do it. That's like, showmanship, I think. I don't know. Okay, so historically, it used to be like 9 major points with, you know, the sort of empiric observations of the different meridians. There's now so many thousands of points. Like I said, in general, we only use around 20 per patient. The needles were originally made of all different sorts of materials. I'll show you a cool picture I found of it. Different lengths, different thicknesses. One of the other pieces of doing the treatment with acupuncture is how deeply you needle at an angle, if you twirl, if you don't. There's some people who believe that you need to get something called de chi, which is this almost like if you hit your funny bone and you get that shock going up you, that sort of feeling. And if you get that, then you know you've got a good needle stim. Other acupuncturists, like the Japanese schools, are much more gentle. They don't think you need de chi. So now we're getting into some, really like high-level discussions about it, probably way over my pay grade. Here's some old acupuncture needles. That sounded kind of cool, a little frightening. And this is the kind of stuff that I would use. They're very fine. They're basically one-time use disposables. There's, as you see here, these different things. These are the little tubes that you place the needle in to sort of allow yourself, because they're so fine, to get the right oomph. You can also have these very, very tiny needles that can stay in, and these very, very tiny needles. And here's the magnets again. Finally, there's a whole group of people who do just using a laser and a laser pointer, and using points and stimulating points in that way, which is very good for people who have needle phobias, and also good for kids, and also people where maybe you don't want to use needles because of a worry about infection, something like that. So there's different ways that you can think about stimulating those points, okay? Now I'm going to move and just sort of talk about therapies. This is a non-cancer realm. There's been a number of documented areas where acupuncture is being used. Chronic fatigue is one. The paradigm in chronic fatigue is that there's this heat, damp heat, there's this deficiency of qi, there's this blood deficiency, so all this sort of deficiency stuff that you need to address in the various points. Back pain has been studied a lot. Back pain's a huge problem. Also, it's a very big problem in terms of out of work time, right? And so it's fairly, acupuncture is fairly effective for that. And then there's some autoimmune conditions. So I found some stuff on lupus with herbs, sciatica, even varicose veins, which I thought was interesting, a sort of combination of acupuncture plus warm herbs and various things. That sounds pretty cool. And then women problems. I found this, there's all these acupuncture models, but here's one with a baby in it. In pregnancy, there are forbidden points that you do not want to use because they could cause a miscarriage or early labor or something like that. And I think this one shows the points that you can use. So infertility, acupuncture and herbs, menopause symptoms, PMS. There's even literature on using acupuncture in small fibroids to shrink them. Various interesting things. But let's move to cancer care now, sort of finish up talking about that. The National Institute of Health developed a research body to review and research, it's called NCAM, review and research acupuncture and other complementary and alternative medicine. And so there's been a series of publications. There's also another organ called the Cochrane Group, C-O-C-H-R-A-N-E, that reviews studies for how rigorous they are in their science and makes kind of summary papers where they'll say yes or no, or this is bad data on this or good data. In that setting, what's sort of being identified is that there are two big places in cancer care where acupuncture has been shown to be, by our rigorous Western way of looking at it, useful. And one is in chemotherapy-related nausea, vomiting, and chronic pain. Okay? So I'm going to come back to that, and I'm going to come back to some examples, but I want to also bring in the concept of palliative care, because I was thinking about it on the plane. So I was thinking about, and the kids running, and my person next to me throwing up, and I was thinking about palliative care, and I was thinking, palliative care is like traditional Oriental medicine. Palliative care has the same values of being a holistic intervention, right? So in many ways, palliative care and acupuncture are great friends. They're great. That's sort of a good connection together. And we think about palliative care in two ways nowadays. We think about offering great supportive care to anybody who has something that's causing suffering, say as they're going through cancer, whether it's vomiting or pain or psychic distress. And then there's also palliative care at the end of life for people, which is the more traditional way we think about palliative care in terms of hospice. And I think both elements are holistic. Both elements combine the importance of intervention for the spirit and the body, which is very much the way traditional Oriental medicine is. So they kind of complement each other. Oh gosh, that didn't work, did it? Looked good on the screen, but pain, fatigue, nausea, vomiting, breathlessness, depression. So I wanted to talk about these areas for intervention and sort of finish up my acupuncture piece a little bit with this. These have been studied in terms of acupuncture and interventions. Pain management is very complex. What I would say is pain that's responsive to alleviation by a modality like acupuncture is usually short-term pain, which is probably why it's good in surgery. It's good for things that haven't been around for a long time. Pain that's chronic, that's been going on for decades, say someone with terrible rheumatoid arthritis and it's caused destruction to their joints, you're going to have a hard time alleviating that and curing it with something like acupuncture. So you have to think about that. There's deep pain called visceral pain. There's superficial pain, which many people are familiar with who have received chemo, called neuropathy. Those are things that can have interventions with acupuncture fairly effectively, okay? And here's just some points, looking at the organs. These are liver points, conception vessel, which is the one going on in the center of the body, bladder, which I'm going to talk about more in a minute. Anyway, various points for pain. Fatigue is a huge problem, okay? And you can start to see from what I said how you can understand fatigue in a very holistic way, right? You can see how you can use the word deficiency with fatigue, stagnation, right? I mean, there's so many pieces to why people have fatigue. Turns out acupuncture is a great tool for cancer-related fatigue. And just sort of listed here some points, but I wanted to focus on, and this is something you can do for yourself, and there's a great legend to it. Zusan Li, stomach 36, great point. Can't hurt yourself with this. So it's on the outside, okay, it's on the outside, and it's, as you see, as demonstrated, it's about a hand breadth down. You'll feel a little dimple right there. And when you get it just right, it's almost like a little tiny ache. You can press on it. Anyway, Zusan Li, the legend goes that Zusan is 3, Li is miles, Chinese miles, and it's a 3-mile point that the emperor's soldiers would tap on so they could march another 3 miles. So it's a high energy point. It's used in a lot of stuff. It's also used in chemotherapy, induced nausea, vomiting, and so forth. So that's good. Another really good set of points is this fascinating meridian called the bladder meridian. And here it is. It's very complicated. I told you that the body is symmetric, so you have the same meridian on both sides. The bladder has actually 2 lines on each side, okay? And each point is thought to be connected with something deep. And there's a lot you can do with those back points. They're used a lot in massage. They're used a lot in a lot of other modalities. And they're probably, I think, the bladder meridian points that are being stimulated by these other modalities. So it's really quite interesting. And here's just an example of you seeing those needles being used here. Okay, nausea, vomiting, said has had a lot of compelling research and documented efficacy And there's, again, many different points. Back to what I said, it's going to be dependent on your practitioner's assessment from exam and history about why you have it. The nausea vomiting is the end result of something holistically inside of you that's off. It's not going to be the same every time. Okay, so there's lots of different points. The one that's really famous is pericardium 6, and that's being commercialized. Use it for C-bands. Okay, for instance, here's PC6, and you all can find it on yourself. You basically, right in the middle of your wrist, you kind of just follow it down until you feel a little bit of a hollow. And that hollow is pericardium 6. The importance of that is the C-band doesn't always go in the right place. Got to be in the right place for it to work. So you can actually stimulate yourself. And that's usually where I put a magnet on someone in addition to maybe a few of the back points after a session. So pericardium 6, as you see here, all these kind of areas, and here's it's being measured, okay? Now, Betsy asked me to talk about marijuana. So I looked up to see if I could find any studies, as now marijuana has become legal for medical intervention. And I really couldn't find anything that compared marijuana and chemotherapy-induced nausea vomiting compared to acupuncture, right? The studies, let me just backtrack to say, for chemotherapy-induced nausea vomiting and acupuncture, compare acupuncture plus antiemetics, which we give, like Zofran or Compazine or Amend or whatever ones are useful, compares that to those antiemetics by themselves. That's really the standard way the studies have looked at it to see if the acupuncture helps. I mean, this is, the antiemetics are important. Acupuncture can add to that. That's usually how it's looked. So there hasn't been that. I did find this Israeli study from this year that looked at a cancer center. They looked at 17,000 patients to see who was taking marijuana. And they found that there was 279 who had received a permit from their oncologist. I'm not really sure what that means in Israel. I don't really know how that works there, what their legal thing is. I didn't have a chance to check that out. But that's a very small percentage of all these cancer patients were taking medical marijuana. Interestingly, more than half were women, and the majority, 84%, had advanced metastatic disease who were using it. Interestingly, the age range was from 19 to 93. I was like, oh, okay, that's good. Side effects very mild, fatigue and dizziness. And again, this was a very subjective, but pain was improved 70%, appetite 60% improvement, well-being 70%, and nausea 50%. That 50% to me seems low for nausea. You know what I mean? It's much higher in acupuncture studies, but again, I think you need the direct comparison. So that's all I can tell you right now. Okay. Breathlessness, which can be a big problem for some people with advanced cancer who get malignant pleural effusions or if they have metastatic disease involving their lungs. And there are lung points. This is the lung meridian. It's one of the simplest meridians. So I like it because I don't have to remember a lot of points. But this is the lung meridian that's used. So basically, that one would be probably a little scary to use, lung 1. And then lung 5 is a really big point that can be used for breathlessness. Depression is another really big problem that many people battle with. And in the setting of cancer, with all the anxiety and anguish and ups and downs of lab values and recurrences and so forth, be a very, very big thing. And acupuncture has been extremely helpful. Again, thinking about it in the sort of holistic, looking at the patient. I just want to point out one point that I find really fun, which is called yin tang, which is right between the eyebrows. And another point, do I have it here? I don't have it here, but it's good, which is like right in the center, which is GV20. And when I think about sort of these are sedation points, we use them all the time when we comfort people. We rub their head, we rub their brow. And again, I sort of wonder about that in terms of this. Another important point is Shenmen, which means heavenly gate, heart 7, so right here on the inside of your wrist. and that's a sedation point, when someone's very anxious and very upset. So again, these are just sort of fun points to know. I wanted to stop for a minute and find out how we're doing for time.
Oh, we might want to start taking comments and questions
That's
in
what I
the
was
next
thinking.
couple minutes.
Yeah. So I was thinking what I would do is just finish with talking about contraindications and then maybe close so that you guys could share with me your thoughts. Okay? And basically, contraindications are just like any other thing. If someone has a low platelet count or risk of bleeding, any intervention could increase bruising or bleeding. If someone has immunosuppression or low white count, they probably are at higher risk for infection. And just as with any other intervention, might want to be cautious. That might be a reason to use magnets or use a laser pointer instead of actual needles. And the final place that I'm pretty cautious in people who experience cancer is people with lymphedema, who have swelling where they have a reduction in their circulation because they're at risk for infection, cellulitis of the skin, and adding needles. I'm pretty cautious about that. So those would be, I think, the things that I would cause complications. So I think I want to sort of stop here. The rest, I had a few more slides on massage and herbs and stuff, but it's really pretty much this is really the core. And thank you, and see what kind of questions you have. Yes, sir.
This is not a question, but I have used acupuncture twice in prostate cancer treatment. One when I was undergoing radiation, and the other when I had hormone shots. And I may be anticipating some more hormone. But it was extremely centering, and it just made me feel as if this is something I can get through. So I don't know whether, what particular points, there was not a great deal of theory about it. It was just a belief on the part of my pastor, who is an acupuncturist, and he set me up with somebody in Baltimore and then set me up here in Shelburne Falls. So it was very, very helpful to me.
Thank you for sharing. I'm just going to repeat a little bit of what you said for if you couldn't hear it all. But basically, what's your name?
Alan.
Alan. So Alan just shared that he's received acupuncture and found it very centering, which I think is a wonderful way to describe how many people feel about it. Thank you.
Right.
Yeah. Do you want to add any thoughts? Anybody? Yes.
You mentioned using magnets along with acupuncture. Would you comment on just using the magnets?
So the magnets are these low dose magnetic fields. They have a side to them, a north and a south side, and they seem to stimulate points. Basically, before you decide whether you're going to do a needle or however you're going to do it, what a lot of acupuncturists will do, or at least the people that I learned acupuncture from, is to check it out by pressure. And so what you might experience is that someone feels certain areas first and sees how you react to them, sort of has a sense of them from your response. The best example would be you can really feel it when you get a massage, and there's certain places if someone hits them, you go, oh, yes, that's it, right? I mean, we've all experienced that. That's your point, right? If you find that, that's a place to needle, or that's a place to place a magnet. The thing about a magnet is that you can go home with it. And I've had some of the people I've cared for where they're like addicted to their magnets. I mean, like they come back like a week later, they're still on, you know? I mean, they're crusty and they've showered, they've taped them back on. I mean, they really get so much, they drive so much response to them. Does that help, or have you had an experience with magnets yourself?
I would say I might be addicted to magnets, but I guess the question is it all in my head? And if it is, so what?
I'm going to take that wonderful question and reframe it to ask the question, where does placebo, okay, come into play with something like this versus something like chemo or Zofran or Dilaudid or whatever? Placebo effect definitely plays a role in a lot of interventions, okay? But that doesn't mean in and of itself you're not having a response. Placebo just means we didn't actually think we did anything, but you felt better. That's how I define placebo. And when I think about what happens in an acupuncture visit, I mean, I look at my acupuncture practice and I'm like, I'm spending this luscious hour of time where I'm touching a patient and tinkering with this and that and the other, versus like my office hours, which some of you have experienced, where I'm like, hey, how are you doing? Okay, let me just see. Okay, so is your medication list up to, oh, great. And any problems? Okay, a prescription? Okay, great, bye. Now, what do you think was the most therapeutic? I don't know. Let's just say there's no placebo effect in my office hours. Zero. Okay, you basically have to spend your time forgiving me. You know. So I don't know. I don't actually think so. I think if you feel better, you feel better. That's fine. You don't have to overthink it. I'm good with that. Yeah. All right. Any other questions? Yes.
For someone who wants to use acupuncture to help reduce chemo-related nausea, say, do you have to have it a certain number of times a week or a month?
Yeah.
Over a certain period?
Yeah. So I don't know totally the answer to that because I've seen lots of things done. What I would say is, as a rule of thumb, something that's an ongoing assault on you, you probably need some ongoing healing. That it's different than you know, like the story you hear is someone broke their bone hiking and shockingly they happen to be hiking with an acupuncturist who pulled out her needles and, you know, put them in, you know, large intestine 4 and boom, your pain was gone and you could wait for the helicopter to get you out, you know. You didn't need another acupuncture visit. You know, in chemo, you have this ongoing assault on you, so you're going to have constant shifts and stresses that interrupt the flow of your chi. Let's just talk Chinese here for a minute, you know. And so, yeah, you're going to need to have ongoing therapy. The usual rule of thumb is once a week, although there are some people who say you need it more frequently than that. That's very expensive. You know, acupuncture costs $50 a session to $120 a session, depending on who you see or how much work they do, or if it's a first visit, or if you have a senior discount, or right. I mean, you know, it's expensive if your insurance doesn't cover it, so that factors in. But I think about once a week, ish. Yes.
As you mentioned, the cost can be a barrier to care, and I wanted to mention there is a bill in the Massachusetts legislature to mandate insurance coverage for acupuncture for 4 conditions, 2 of which are nausea and pain. And it just made it out of, I think it was healthcare financing, which is the farthest this bill has made it, or a version of this bill has made it in years and years and years of trying. So it would be a good time to contact your legislators and say, you know, please vote for this. This is valuable to New York, and we'd like to try.
Do you find acupressure equally effective as acupuncture?
So acupressure is another modality that is sort of maybe what you're doing because someone has a needle phobia, or you're sort of a masseuse at heart, or you know, for various reasons. There definitely are, especially in the back, certain points that I think you access better with acupressure. So you know, it's going to vary. It's definitely another nice tool to use. The warnings apply to acupressure as they do to acupuncture in terms of someone who's on anticoagulants, blood thinners, someone who has a low platelet count. The deep pressure could also cause bruising or internal damage. You have to be careful. In many ways, it's a little bit harder in terms of the pressure than light needling. Okay. Yeah. Yes.
I have a friend who, when he was well on his way to dying with prostate cancer, had terrible neuropathy in his feet and found that acupuncture helped. Is there anything that you can say? What does that mean? What help does acupuncture provide to neuropathy, particularly in the feet?
Yeah, so that's a great question. Neuropathy, and I imagine some of you may have experienced this, there can be variations of neuropathy. It can be that you have a feeling that your feet are on fire. And people may experience this, it's worse when you're lying down than when you're standing up and walking around for a little bit. It kind of gets better when you're kind of stomping around a bit. But when you're in bed at night trying to sleep with all the other stuff you're dealing with, all of a sudden your feet are on fire. So that's one way that neuropathy can happen. The other way is you're numb. The numbness is not so much a pain, but more of a danger that you could fall or not feel your feet or get in trouble driving and stuff like that. In terms of acupuncture, my experience has been that it's very helpful for the burning pain type of neuropathy more than the numbness.
So literally alleviates it?
Yes, it sort of lifts that burning feeling that you might have. Yeah. Yes?
I've done acupuncture twice before my diagnosis, both times very, very successful. And I've just started now, and the breathlessness is one of them. But also, I find around 3 o'clock, I hit a wall. No matter if I've been great all day and I can have some energy, 3 o'clock I hit a wall where I just have to lie down and maybe sleep the rest of the night. What are the herbs and the vitality drugs so I can make it through the day besides Ritalin?
So the question was fatigue. Acupuncture helps, but despite that, you hit a wall and really have trouble doing your activities. Yeah. It's hard to say that there's one particular herb. I would say in the palliative care world, there are various recommendations like using Ritalin, using certain sort of stimulants to help in that setting. People who are on narcotics, a lot of time people from a palliative care background will sort of try and think of some other medicine that's given in the morning so it doesn't keep you up all night that stimulates you. I suppose there probably are herbs. I'm not an herbalist per se.
They always affect me very badly.
Yeah, I'm not an herbalist per se, so I would be cautious about that. But again, if it was something that you're interested in, if you see an acupuncturist who also is an herbalist, they're very good at sorting out that balance. But they'll probably examine you to sort out which kind of fatigue it is. Getting back to, there's not just one kind of fatigue. And you got to sort that out to know what's the best intervention for you. Yeah.
One more question, and then we should probably wrap up.
You mentioned two kinds of things that can happen with neuropathy, but what if it's not numbness or burning, but what if it's what you would call, like when your foot falls asleep, sort of pins and needles effect? Is that something that it can help with?
Yes. Yeah. Everyone's different. Back to my point about chronicity, is that if something has been going on a long time, it usually takes multiple sessions and sort of a little bit of kind of basically figuring it out and trying different interventions for your practitioner to help you. So the whole thing where you put that one needle in and miraculously you're like, running out to the mountains to climb in. Probably it's just sort of a long, kind of steady healing, readjustment.
So I'd like to thank Dr. Goodman. And part of the intention of this program was to begin a formal dialogue with Mass General and our cancer center, which is slated to open in about a year, to really look at modalities other than our Western approach that we can add to improve our patient care. So I just want to plant that seed for you all because we're very excited to have this dialogue.
We are
Thank you.
too. Thank you.
Thank you.
Thank you.